For some women, pregnancy can cause abdominal separation, a condition where the two right and left sides of the most exterior layer of your abdominal wall, the rectus abdominis, spreads apart at the body's midline. Abdominal separation reduces the integrity and functional strength of the abdominal wall and can aggravate low back pain and pelvic instability. Abdominal separation in one pregnancy greatly increases the likelihood and severity of separation in subsequent pregnancies. To find out if you have abdominal separation, lie down on your back with your knees bent and the soles of your feet on the floor. Place one hand behind your head and the other hand on your belly with your fingertips across your midline at the level of your belly button. With your abdominal wall relaxed, gently press your fingertips into your abdomen. Roll your upper body off the floor in a crunch. Feel for the two parallel bands of muscle tissue. Make sure that you don't simply pull your head off the mat. To contract your abs, you need to pull your rib cage closer to your pelvis. If you don't activate your abdominal wall, you might assume that you have abdominal separation. But most of the time, as you pull your rib cage closer to your pelvis and the contraction deepens, the gap at your midline will decrease. A small amount of separation, 1 to 2 finger widths, is normal and not a problem. But if the gap at your midline is more than 2.5 finger widths, or if you can see a small mound protruding along your midline, then you have abdominal separation and need to take a few special precautions. Avoid all movements that increase stress on the midline, such as where the upper body twists and reaches back. Avoid body positions that stretch the abdominal wall, such as lying back over a large exercise ball, and certain yoga postures, such as cow pose, up dog, and belly breathing, where the abdominal wall is overly expanded during inhalation. When performing exercises that strengthen the external abdominals, such as crunches and obliques, splint your midline together with the fit band. Demonstration of this technique is found in the post-pregnancy abdominal wall training techniques section. If you contract a cold or the flu after childbirth and you find yourself coughing and sneezing a lot, place your hands across your belly and manually splint your abdomen together during coughing episodes. This will provide additional support and prevent further separation of your midline. Abdominal separation resolves when either your muscles have pulled back together to less than 2 finger widths, or when you can feel that your midline has once again become strong and elastic. At this point, you'll no longer feel a hole in your abdomen. Abdominal separation can last up to 6 months postpartum.